Hey, so this is my response to week 6 discussion. So to the first prompt, there was a concern of child abuse or neglect of Kelly's stepson, and we saw that he had been taken to the hospital. They had found some bruising on his cheek, which appeared to be a handprint. He was vomiting, falling over. And eventually Kelly did confess to having abused his stepson and causing those injuries. So while there was a concern, it was a legitimate concern, and it ended up being a legitimate issue and risk factor. Also, his ex-wife explained that there was significant domestic violence in their relationship. Aside from him abusing his stepson, he also abused his ex-wife. So he had pushed her against a wall, choked her, and had been physically abusing her since July of 2011. She also reported that he threatened her, that he would choke her and, quote, pass her out. On a separate occasion, he did choke her, kicked her in the stomach, dragged her to the bathroom by her hair, and threatened to waterboard her before sticking her head directly under the shower head. He was also emotionally abusive towards her, and he would threaten her often with potential violence, also violence towards himself. So on another occasion, he threatened her at gunpoint and then also held the gun to his own head and pulled the trigger 3 times. And further, we also saw that there were reports of sexual abuse. So sexual harassment, sexual abuse, rape, all of that. He was the perpetrator of a significant number of violent incidents. So these violent behaviors definitely could be seen as risk factors to the violence that he ended up committing afterwards. So what interventions were done? So Kelly voluntarily entered a mental health facility in February 2012. He then also, I think 2 days later, voluntarily entered an inpatient treatment, and he was diagnosed with adjustment disorder with depressed mood. So he had caretakers and physicians who had the ability to diagnose him. And based on this diagnosis and other mental health conditions, he was prescribed multiple medications for anxiety, depression, among other things. I think there was an ADHD medication as well. So for many, many different things, he was prescribed pharmaceutical intervention as well. And he also participated in a psychoeducational therapy group, which they reported had actually seemed to help him at that point. So do you think any interventions could have been put in place or offered to him that weren't? So I do agree that more mental health treatment should have been provided. He also seemed to do well in the group therapy, as I just mentioned. So I think that should have been an option for him to continue it, not just doing it while he was in that inpatient treatment facility. I think that if he dealt well with it and it seemed to be helping him, I think that should have been something that continued. I also think that the military should provide more mental health assistance to anyone involved in the military. Research shows how military service affects mental health, and with all of the other exacerbating circumstances, I think that he should have been provided more mental health options within the military itself. There's a possibility that if they had provided this instead of him seeking it elsewhere, it would have had a more beneficial and more consistent outcome for him. And I think consistency for him would have been the key, because he did well while he was going through these programs, and then things kind of turned. So I think that consistency should have been like the number one thing for him, going through mental health treatment, but on a more consistent basis, and provided inside of the military, because those are the people who, would understand military circumstances much better than somebody who doesn't deal with veterans or anybody who's been part of the military. So prior to the church shooting, I would have rated him about a 7 or 8 for potential future danger. This is because research shows that there is a significant correlation between domestic violence and mass shootings. So I would have been on high alert to begin with because of his serial domestic abuse perpetration. It can tell us a lot that somebody is at a higher risk of committing a mass shooting of some sort, because they have been a domestic abuser in the past. Also, he had access to weapons, obviously, and he knew how to use them. So that's another significant part. But putting it all together makes it a much higher risk. Just having weaponry and just knowing how to use it does not make you, in and of itself, a violent person. There are plenty of people who have and use firearms who are the furthest thing from violent. So the fact that he was a domestic abuser and has this history of all of these types of violent acts, he also seems to be very impulsive. There were a lot of triggering events in his life that led him to commit a lot of these violent offenses. So that, with putting that together with the fact that he had this weaponry, knows how to use it, has threatened to use it, all of that definitely puts him at, I think, a higher level on the scale. He also had a history of control and manipulation. That was part of his domestic abuse. And like I mentioned before, a lot of military service members, unfortunately, do struggle with mental health issues, whether that's going into the military with that, or the military, unfortunately, kind of being a catalyst to. So because he went into the military already having committed violent acts, it would be more likely that he would be violent after, because his mental health issues were probably exacerbated by being in the military, and not having enough intervention, appropriate intervention, consistent intervention. Altogether, I think that I would place him at about a 7 or an 8 on the scale. Maybe even higher now that I'm thinking about it. And so for the last part, as I mentioned prior, I think that having had more mental health options and interventions in the military would have helped significantly. He needed more consistent therapy, and therapy that specifically catered to service members. I would also have wanted to provide him with implicit or explicit bias education and training, because that is where a lot of this kind of mass shooting violence stems from. People just don't understand certain populations, so they kind of take their anger out on them because they just don't understand, and they see stereotypes, or they hear stereotypes and they believe those, and they just go forward from there. So bias training, I think, could have helped as well. And so this next portion, so research tells us that anger management does not necessarily help domestic violence perpetrators. So I am going to say that I do not think that anger management specifically would have been an appropriate option for him, because I don't think that really would have done anything for him. But with that said, I do think that had he learned different ways to possibly channel his aggression, so even if he still got angry and was still aggressive, different ways of, sorry, you can hear my son, different ways of just channeling that out to get that emotion out without harming other people. So there are some people, I mean, so this is still like technically, I guess, harming people, but like a lot of people who have anger problems or this kind of like hostility or aggression do like they take boxing lessons or something like that. They get in the ring. That's somewhere where you can get your aggression out in a controlled environment. And I think that may have helped him having that kind of outlet for it. Because it's a controlled environment, I think it would be more beneficial than just like sending him to anger management. I don't think anger management would have helped, as it generally doesn't. And lastly, he seemed to be triggered by a lot of different events in his life. So understanding and learning what his triggers were, like for him to be educated on what his triggers were and how to either cope with them or, and I don't want to use the word avoid because you should never avoid things, but if he knew that a trigger was going to happen or he felt a trigger making him angry, then he could have averted that and made sure that he was channeling, again, that anger into some other behavior that was more beneficial to releasing that anger but not harming himself or other people. So I think that those would have been really good options for him. So he did not end up doing what he did.